Good morning, soon to be afternoon. I'm Cindy Thomas here at St. Clair Senior Center, and my job is a caregiver information coordinator. Therefore, in that job, I am also the Alzheimer's Association ambassador for the 4th District of Tennessee, which my congressman representative that I speak with is Scott Desjardins. And that's kind of what I was going to talk about, keeping contact with the Congress through him. And I've just recently came back from Washington, D.C., where we spoke to many congressmen about this mind-stealing disease of Alzheimer's. And I wanted to get started and give you some ideas and some facts and figures and what is being done. So first, the update. We'll turn the lights down low, and this was in Washington, D.C. This is some of our ambassadors. You will notice we wear purple sashes on the hill. We also go on the Tennessee Capitol Hill, usually in February, and advocate. And I'll tell you later how you can get involved. All right, I wanted to give you a couple of the Alzheimer's Association videos to kind of give you an idea of what they've got. There's facts and figures that they've got. Our first one. On Tuesday, April the 5th, last week, there was a record-breaking number of Alzheimer's advocates that covered the nation's capital. It was a record number of nearly 1,200 advocates, and that's our ambassadors and advocates all together, not the ones supporting them also. And we met in Washington, D.C. between the 4th and the 6th for the Association Advocacy Forum. On the morning of Tuesday, April the 5th, the advocates, we gathered in a general session to talk about what kind of impact we wanted to put on Capitol Hill and to hear the congressional Alzheimer's supporters and learn how to continue to create policies. That was an all-day event, and then at dinner the next day, we had several congressional advocates that were congressmen, congresswomen, that came and told us how it had affected them and their families and what their plans were. The highlight was on Tuesday. We had Kimberly Williams-Paisley, which is Brad Paisley's wife, here from Nashville, Yahoo, Tennessee. She has just written a book, and it was released last Wednesday, Where the Light Gets In, and it was talking about her mother. And her mother did not have Alzheimer's per se. It was an aggressive aphasia, progressive aphasia disease, which mimics Alzheimer's. And it talks about her time with her mother, I purchased that book on Wednesday. It is a wonderful book, and it will be available for you to borrow to read. It was really nice to see her. Her father was with her. Her father was the major caregiver, and he, like a lot of us, kind of wanted to hide some of the things to keep her from being embarrassed about her condition and different things. And it tells how they went through their caregiving life and the struggles that they had. And it's a very good book for you to check out. This is kind of like a gram of, for 2016 of the ages of people in the United States that's with Alzheimer's. An estimated 5.4 million Americans of all ages have Alzheimer's. If they're below 65, we call that early onset Alzheimer's. And that is getting to be very prominent. We've even found some that are in their late 20s, early 30s. And it is found that you may have Alzheimer's 20 years before you even know you have. So this includes an estimated 5.2 million age 65 and older. Approximately 200,000 individuals under age 65 have the younger onset Alzheimer's. 1 in 9 people age 65 and older have the Alzheimer's disease, and about 1/3 of the people age 85 and older have Alzheimer's disease. 81% of these people who have Alzheimer's disease are age 75 or older. So it seems like as you age, the prevalence is going up. At this time, there is no cure. There is nothing that stops it. That's why we're advocating for more funds to get the research going, and I'll speak more on that subject. So 2 million people who have Alzheimer's disease are age 65 or older. That accounts for the 37% of people with Alzheimer's. When the first wave of baby boomers reach age 85, which will be in 2031, it's projected that more than 3 million people will have Alzheimer's. By 2050, as many as 7 million people ages 85 and older may have Alzheimer's disease, accounting for half of all the people 65 and over. So you will see that the older we get, the longer people are living, the more we're going to be dealing with Alzheimer type situations. And just to clarify Alzheimer's, we say Alzheimer's, but it is under the umbrella of dementia. There are many types of dementias, which I've given you a handout on the different types that the Alzheimer's Association includes in all of their research and things, because dementia is dementia, whether it's Alzheimer's, Lewy body, frontal temple. We're trying to take and get a cure for all of it. The projection of the total numbers of Americans by state, and this is our Mid-South chapter. In Tennessee, we're going to say it's 27.3% of our Tennesseans, where in Alabama it's 23.6%. So each state, it seems to be each year it's growing more and more. Alzheimer's kills more people each year than breast and prostate cancer combined. Cannot read my own thing. In 2008, the statistics was 82,435 people had Alzheimer's. At that time, 39,518 had breast cancer, 28,170 had prostate cancer. If you will see on our graph, as the years between 2000 and 2013, their accounts went down below zero to less than 2%. It went less than 11%. And that's because they've had research going and getting the money that they need to get that research going to combat the breast cancer and the prostate cancer. And they're having good results. And we don't fault them at all. We are excited that they're getting results and successes. But we want results and successes, because during that time, ours went up to 71% in the positive of how many people are being affected, and there is no cure. So that's why we're fighting. As we've seen, it's the 6th leading cause of death. There's more than 5 million people living with it. That means 1 in 3 seniors will die with Alzheimer's or another type of dementia. In 2015, more than 15 million caregivers provided an estimated 18.1 billion hours of unpaid care. I think all of us have kind of been in those trenches. I myself had a grandmother with Alzheimer's, and pretty sure that there are other family members that are developing it at this time. So yes, it's very important to myself, because I may have it or whatever. I want to be sure that there's a cure before my grandchildren have to deal with it. And you know, with those family caregivers, they're spending over $5,000 a year caring for someone with Alzheimer's. That may even be with lost wages and having to pay the extra money for medications or treatments or care that they need that they are not able to provide, and they're having to find the money to take care of that. That may mean they're missing a family vacation, which could be detrimental if they've got children, because they need that time with their children also. And some of them are actually going hungry because they're trying to pay for all the medications and everything, and they're not being able to buy the food, the nutritional food that they need. So every 66 seconds, someone in the United States will develop this disease, which has costs, and is projected to cost in 2016 $236 billion. As I said, it cannot be prevented. There is no cures, no treatments. 1 in 3 seniors, and I'm trying to get this in your head, that how desperate we are in need of help and research and funding. One of the things that's a major thing is that only 45% of those with Alzheimer's or have developed it within this year are actually being told that they have Alzheimer's. And that's something we are working on correcting, is getting the doctors to notify at an earlier time. More than 90% of these people with this disease may even have other types of diseases or cancers or things that they're dealing with also. By 2050, these costs could rise as much as $1.1 trillion. And we're talking about the $236 billion that's being spent. That's our Medicare and Medicaid dollars. So what is that doing? Bankrupting us. So if it continues to grow, where's the money going to come from? So we have got to find a cure, treatment, something. So what is your caregiving task if you have dementia? You're helping with instrumental activities of daily living, such as the household chores, shopping, preparing meals, providing transportation, arranging for doctor's appointments, managing finances and legal affairs, and answering the phones, making sure that people are taking their medications correctly, either by reminders or direct administration of these medicines, helping the person to adhere to the treatment recommendations for dementia or other medical conditions. They may not even know how to take care of themselves, and you're having to try to take care of that and remind them and guide them along. Assist with their personal activities of daily living, such as their bathing, their dressing, their grooming, their feeding, and even helping them to walk or to transfer from a bed to a chair. Use the toilet and manage incontinence problems. Managing behavior symptoms of disease, such as aggressive behavior. Some of the things with aggressive behavior, it doesn't mean they're wanting to be aggressive, it's because they're frightened. They don't know what you're doing. They're lost in this world, and you're just walking up on them. Suddenly it frightens them, and they may retaliate. They might fight back. They may think you're trying to take something from them, that you've hidden something from them. They get very paranoid. Those are, those aggressive behaviors, it's not something they want to do, it's a reaction. And they will wander. A lot of times you will find, and it's like I told my father, I said, if you develop Alzheimer's, please let me know what your route was to Memphis, Tennessee when you drove a truck, because if you go missing, that's which way I'm going to have to go looking. So they will do repetitive activities. You've heard them. They'll ask the question, and then they'll ask it again, and they'll ask it again, and they'll ask it again. So the way to manage that is to find something that you can redirect them into another, distract them into another activity or something. And it doesn't mean they're not going to ask it again, but for a little while you'll quit answering that question. Finding and using support services such as support groups and adult day services programs. We have those, both of those here at the center. I have a caregiver support group that I have, which is the fourth Friday of each month. The second Friday of each month is specifically for Alzheimer's support groups. I also have a grief support group because that's a loss too. So you're welcome to come to that. We do have the adult day service that is here Monday through Friday, and you can speak to Amanda Puglias. There is another adult day service in town that is Mindful Care, and they work out of New Vision Baptist Church. So, check out. There are all kinds of resources, and I am your resource person. You have any questions, come to me. I'm here Monday through Friday. Usually I put my hours 9:30 to 1:30 is when you usually can catch me. Well, I work longer, but those are my main hours. So you also will need help making arrangements for paid in-home care. It doesn't mean that you have to have home health. There are agencies out there that can come and just do errands for you, or just sit with them, or be a companion. They don't have to do anything medical. There are agencies out there that can help you. Hiring and supervisors, others who provide care. That's another one of your job duties, because you're going to want to make sure your loved one is being taken care of by someone that you can count on and has not had a criminal background. I advise you to do background checks on anyone that comes into their lives, because they're your precious treasure. They've given you all they can out of their life, and now it's your turn to give them the best that you can for the rest of their life. Assuming additional responsibilities that are not necessarily specific tasks, such as providing overall management of getting through the day, addressing the family issues related to caring for a relative with Alzheimer's disease, including communication with other family members about the care plans, decision making, arrangements for respite care for the main caregiver. Get the family involved. Let them know what you need, what things to help out. Keep them informed so that they realize what you're dealing with, and if you were to get sick or in the hospital or something, that they'll know how to step in and who to look to get help if they need it. One of the things I heard that I thought was a wonderful idea, you feel like that you can You want to take care of your loved one, and nobody can do it any better than you. Well, sometimes somebody else has to step in. And there are ways that you can get extra help. And one of the neat things I heard is put a bowl out on your table, and every time you think of something that could be done, like your shrubs trimmed, or your windows washed, or run to get some ice cream or something, put that on a little piece of paper, put it in the bowl. And if somebody asks, what can I do to help? I don't know what to do. Say, look in the bowl. Good idea. And if they find something they don't like, say, put it back in the bowl, find another one. But there's things that come up in your day that you think of that you would like to get done, and you just don't have the time to do it, such as scrubbing those baseboards. I've already getting my daughters in on that one because I can't do that now. So get the help. That's what you need to do for yourself, is get the help. I know this is a lot of words. Basically, the HOPE Act, that is one of the things that we have spoke to the Congress about, and it was started in 2011, and we are trying to get all the congressmen to co-sponsor. And as of right now, we're still working on Scott Desjardins to co-sign this bill, and it is to provide Medicare coverage for the comprehensive care planning services for both the individual and the caregiver following a dementia diagnosis. And there again, we want the doctors to diagnose it early so that Medicare will come right on in there and give them the time that they need to get the care planning set up for that patient before they get to the point that they have no control over their care and someone else has to take care of it. They get to let their needs be known. To ensure that dementia diagnosis and any care planning is documented in the medical record. You want that to follow in their medical records through all of their doctors. Like when they're in the hospital will know they have that diagnosis. They will turn their care toward being sensitive to the cares and concerns of a person with dementia, even with your police force, to let the police force know that they have a dementia so they can handle situations better. We want to get out and educate our police and our firemen and things on how to deal with certain situations, that these people may be doing things that they don't realize that they're causing harm to themselves or someone else. Educate providers about the new benefit to identify any barriers individuals face in assessing care planning. Education, that is a big thing with Alzheimer's. Educate, educate, educate. People need to know. This has been such a subject that people have used as a taboo. They don't want to talk about it. They don't want to admit their relative has a dementia. Get out there and talk about it, because in 25 years, half of the 65-year-olds are going to have dementia, the way the statistics are going? We want to solve that. So we need to fight it. We need to let people know what our needs are. Don't hide it under a basket. Get out there and advocate for our loved ones. So actually, we want Medicare, which already provides coverage of Alzheimer's disease diagnostic services, but we want them to also cover our care planning. The Hope for Alzheimer's Act builds upon the existing Medicare coverage and will provide the time for doctors that they say that they need to talk with the patient. So you're not in the office and out in 15 minutes. They're going to have time to speak with you. The Hope for Alzheimer's Act also takes steps to ensure that there is access to care planning services. And it also takes steps to implement the national plan to address Alzheimer's disease by educating and supporting individuals with Alzheimer's and their families, and to educate healthcare providers and enhance the services for the people with Alzheimer's. It will also give the caregiver the right to have access to the health care record of their loved one, because they are standing as a guardian for that loved one. You know, a lot of times the HIPAA law, you know, you can't get information. If you have an Alzheimer's dementia diagnosis, we want to make it easier that the caregiver can come in and help formulate their care planning. This is a new one they come out with this year. That's another bill that they're trying to get passed. And it's called PITA. But what it is a Palliative Care and Hospice Education and Training Act. So it will increase the availability and the quality of care. It establishes palliative care, and palliative means actually comfort care, for the hospice workforce training programs for all doctors, nurses, and other health professionals. So your health professionals are going to be able to get more education on dealing with dementia disorders. Create a national education and awareness campaign to inform the patients, families, and health professionals about the benefits of palliative care and available services and support. And there again, that's part of my job. I'm out here educating everyone I can about what is available so that we can make a difference in this disease. And to enhance the research on improving the delivery of palliative care. So if they get research, maybe they'll find some things that will help out to give them more comfort. They will find out whether these medications like Aricept and Namenda and things, if they're actually working, or do we need to be spending money on it? Is it doing anything? That's what that research is we need. So what can you do to fight Alzheimer's? First thing is you could be an advocate. Now, I'm an advocate and an ambassador, but I have a team that's called the ACT team. I have one person on it. Anyone that's interested in working with me as an ambassador, it would be going and talking to your congressman, writing to your congressman, and I've got your congressman's addresses and stuff up there, letting them know how you feel, how you're being affected. That's a way that we can get some help with how important that these bills are to get help for the caregivers. Another thing that we can do is to join the October 2016 Rutherford County Walk. Teams are being formed right now. There's going to be fundraisers from now till October and probably beyond, collecting money. Last year, Rutherford County collected over $236,000 toward the research, which most of that went to Vanderbilt toward research. We're very proud of that. Rutherford County was second in the state with the amount they earned or raised for the walks. So be a champion. This year it'll be at MTSU track and soccer field again. If you can't walk, which I don't walk, but I do a booth, I'm there, I'm directing people, I'm making sure they get the water they need, any medical supplies they need. There's always ways you can help. There's also, the Alzheimer Association has a trial match. If you think that you have it in your family or you just want to know, you can call them and be in a study to see ways that, you know, if you've got someone that has Alzheimer's, see if it's in your family. That's the way they do research. They need people to do research on, and a lot of times it's just answering questions. I've got several that have been in my support groups that are involved in the trial matches.
What is it called, trial matches?
Trial match. And I have brochures on that in my office also. So I would really like you to contact, you know, the congressman. As I said, Scott Desjardins, I'm working with him. He's got a lot going on in Congress right now with the different bills and stuff, but we want him to know that Alzheimer's is important to his constituents also. And I put Diane Black because there are people in Wilson County and around our borders that we're trying to get through. I have written to Lamar Alexander and to Bob Corker about things, and they've responded to me. So, I mean, get out there and let people know how you feel, what you need, what your story is. Tell your story. That's important. So the Alzheimer Sociation is the leading voluntary health organization in Alzheimer care, support, and research. And the mission is to eliminate Alzheimer's. We'd like to eliminate it by 2025 because we see by 2050 the country's going to be bankrupt. So it'd be good to find us something kind of cure before 2025. So that's what the risk, the demand is for right now. So the one thing I'm going to ask is to please ask Representative Desjardins to support Alzheimer's research by looking into these different bills and supporting them, co-sponsor the Hopes for Alzheimer's Act, and to co-sponsor the Palliative Care and Hospice Education Training Act. And there are several other bills, I didn't go into them, that are nationwide that they're working on for a national health care plan. So get involved. That's what I'm asking you to do, is get involved. And please sign up to help us out on our walk team. The St. Clair, I'm very proud of them. For the last I've been with it for 4 years, but the last 3 years we've made quite a, fundraised quite a bit, and we've been competitive with some of the big companies. So I'm proud of us. Any other questions? Well, I thank you for coming, and know I'm available here and will love to answer your questions because this is one of my passions, because it is so important.